Hello, anatomy students. Today we are going to finish the respiratory system, talking about respiratory conditions. The start of this PowerPoint presentation, we'll have some review slides from the last time we spoke, and then we'll get into some conditions. It will jump around quite a bit, so try to keep up. Once you're finished listening to this video, you will take a respiratory, or you will do a respiratory review sheet, and that will hopefully get you ready for the test on the last day of class. So last time we talked about carbon dioxide transport, how it's mostly transported in plasma. I'm going to skip a lot here. The Haldane effect, remember, is an indirect relationship between oxygen and carbon dioxide in the body. The higher the oxygen, the lower the carbon dioxide, and vice versa. The higher the oxygen in the bloodstream, the lower the carbon dioxide in the bloodstream. Also remember that slow, shallow breathing is called hypoventilation, and you would solve that problem by rescue breathing someone, hooking them up to a bag, a ventilator, and we looked at the graph last time. Rapid deep breathing is called hyperventilation, and we can solve that problem by breathing into a bag, breathing into our hands, or physically shutting our nose and mouth to slow down our breathing, and that shifts the graph to the left. Carbon monoxide we talked about, dangerous because it's odorless and colorless. And then we hit cough, sneeze, crying, laughing, hiccups, and yawn. So I'm not really going to cover those again. Now let's get into some other conditions. Infected adenoids or infected tonsils happens to a lot of people. It may have happened to some of you. Never happened to me, where your tonsils get enlarged, especially the palatine tonsils, right next to your uvula or lateral to your uvula, and the adenoids, which are at the base of the end of your nasal cavity. So it often leads to mouth breathing. It leads to snoring. It can lead to bedwetting in children, and really the best way to solve that problem is to have a tonsillectomy or an adenoidectomy to remove the adenoids and or the tonsils. And when you become a mouth breather, you don't moisten or warm the air properly. And here's a picture showing the palatine tonsils just lateral to the uvula. Strep throat is a condition that most of you have had, caused by Streptococcus bacteria, and can be easily passed from person to person. The bacteria infect the soft palate and maybe a little bit of the hard palate. The uvula, oftentimes seen in these blotchy red spots around the uvula or soft palate. The biggest thing with strep throat is you must treat it. You must treat it with antibiotics because if not treated, it can lead to a myriad of other conditions. Maybe it could lead into scarlet fever, which is a full body rash, or it could lead into a pericarditis where the bacteria attack the lining of the heart, or it could lead to glomerulonephritis, which is an attack of the kidneys. And those can be deadly situations if strep throat is not treated. Smoker's cough, oftentimes seen in smokers, obviously, hence the name, but could be seen in people who work in situations where the air is not very good, like coal miners, farmers exposed to dust. And what happens is chronic smoking destroys cilia in the lungs, in the bronchi, the cilia. Remember, we talked about way back at the beginning of this unit, hold mucus in the lungs and help sweep that mucus out when we cough. So in this case, a smoker loses those cilia, so they have to forcefully cough to dislodge things in their lungs. And it's kind of a violent cough when they have to do this to get that mucus out. Like I said, we're going to jump around a lot. The Heimlich maneuver you probably have heard of, a maneuver used on people when someone is choking, and the universal sign for choking is to put both of your hands around your neck to indicate that you are choking. And obviously, you can see in the picture that the person who does the Heimlich uses their arms to act as a diaphragm and to forcefully um, make a quick and hard movement inward and upward to try to force whatever the person is choking on out. And certainly, I've had some students in the past that have been babysitters and have had to use this maneuver on kids that they were babysitting. Newborns, infants, you don't want to use the Heimlich because you can severely damage the rib cage. So you use this technique where you pat them with the heel of your hand on their back between their scapula to try to dislodge. And for both of these, the first thing you should do is check to see if you can reach your finger in and grab whatever they're choking on. This word, can you pronounce this word? Most people cannot. I always want to say atelectasis, but the stress of the syllables plays out to atelectasis. And the picture is showing atelectasis. Atelectasis is a collapsed lung. And many different things can cause a collapsed lung. 1 in 100 babies is born with a collapsed lung. A gunshot wound through the rib cage can cause a collapsed lung. Some diseases of the lungs can cause this. Anything that disrupts the pressure gradient in the lungs can cause a collapsed lung. So, on this person's right side, this lung is inflated. On the left side, the collapsed lung. So, the lung has literally shriveled up to right here. There's no more air in the alveoli. And you can see this white space is really where the lung should be. So, to solve this problem, there's really only one way to solve it, and these pictures that I'm about to show you will be a little bit graphic. So, be ready. You have to use a chest tube to equilibrate the pressure, the atmospheric pressure, with the intrapulmonary pressure. And this basically means you take a scalpel and you cut through the intercostal muscles and insert a tube into the chest to equilibrate the pressure. Here's just another picture of a collapsed lung. In this case, it's the same as the previous x-ray I showed you, with the left side collapsed and the right side not. So here is a field demonstration of a chest tube, and this is not real. This is a dummy with some fake blood, and you can see this field doctor has just used a scalpel to put a slice into the intercostal muscles, and then he will insert a tube into the hole all the way into the lungs. This next picture is legit, and it will show a chest tube. So sorry for the blood, but this is what that would look like. And a lot of people would have to have this chest tube in for several days to equilibrate the pressure. All right, some impairments of oxygen transport. We call these hypoxias. Hypoxia meaning low oxygen. Literally, hypoxia means low oxygen. So if you can understand the adjective in front, you can understand the difference between these hypoxias. I'll take you through each one of these. Anemic hypoxia means not enough blood. So you don't have enough blood in your body, and that means you don't have enough oxygen in your body. And massive bleeding or hemorrhaging is usually the most common cause of anemic hypoxia. Ischemic hypoxia. Ischemic is a new word that we may have seen once this entire year, and it's a lack of oxygen, usually to the brain, and it's oftentimes due to a stroke. So some issue with a blood vessel in the brain where the blood vessels are not working properly. You've had an aneurysm, many different things can cause a stroke. Histotoxic hypoxia. Histotoxic means poisonous. So, a person ingests or is exposed to a poison, and this reduces the amount of oxygen in the body. Cyanide, you may have heard of this. Cyanide um, is used in lethal injections to cause hypoxia. Believe it or not, a little tiny amount of cyanide is found in apple seeds also, but no worries. If you accidentally eat an apple seed, it will not cause histotoxic hypoxia. And then one of the strangest group of words we see all year, hypoxic hypoxia. So an adjective that describes its own noun. Low oxygen leading to low oxygen. And this makes sense. Low oxygen in the air leads to low oxygen in the body. So climbing Mount Everest would definitely cause hypoxic hypoxia. The higher up on Earth you go, the more hypoxic you will become, and that will lead to hypoxic hypoxia. So those are the 4 hypoxias. Let's talk about some respiratory adjustments we make just in our normal everyday lives. When we exercise, you may have noticed when you exercise vigorously, you hyperventilate after the fact. So you breathe rapidly, you breathe deeply, and that's to pay off a debt of oxygen. So you've used up so much oxygen when working out that your body has to replenish that oxygen quickly. Hyperventilation achieves that. So most people increase their breathing 10 to 20 times. So you did the lab already. Most of you breathe around 10 times per minute. So when you're exercising, you may be breathing 100 to 200 times per minute to increase your oxygen levels and to get those back to normal so you can continue making ATP in your body. Altitude, we've talked about quite a bit in this unit with the when we talked about Mount Everest. And the thing with altitude is this is a natural adjustment that the human body makes. If you go and live in a low oxygen environment, your red bone marrow will automatically make more red blood cells to account for lower oxygen in the environment. So you will see athletes that go and live in high altitude environments. Colorado Springs, Colorado, there are many Olympic training facilities in Colorado Springs due to the elevation. You train at the altitude, as they say, and you begin to make more red blood cells. In the past 10 years or so, I've seen athletes at sea level wear pressure masks, where literally they work out with a mask on to lower the amount of oxygen that they are taking in to trick their bodies into making more red blood cells. So I said it's the natural way to blood dope. So I actually know of at least one student from Yorktown in the past who has gone to Colorado and worked out the entire summer. A female swimmer worked out in Colorado. If we were to go to ski in a high altitude situation, like a ski resort in the winter, most of us from Indiana would get acute mountain sickness. So we'd get to the top of the mountain on the ski lift and we feel sick. We'd feel like we're going to vomit. We'd get headaches due to the lack of oxygen. And the thing about that is you will eventually get used to it, but it may take a day or two before you don't feel sick on your ski trip. And like I said, there are even some athletes that sleep in hyperbaric chambers where they sleep in low oxygen environments to make their bodies, trick their bodies into making more red blood cells. COPD. This kind of finishes off this unit off. COPD is, I've seen a lot of commercials about COPD, and it's an acronym for chronic obstructive pulmonary disorder, COPD. And by far the most common cause in the United States and across the world is smoking and vaping. So the more someone smokes, the longer someone smokes, the more likely it is that they will get COPD. COPD is really made up of two different conditions, and we'll get to those two conditions: emphysema and chronic bronchitis. So emphysema, you may have heard of this, is when someone smokes or is exposed to a bad air environment for so long that their alveoli permanently enlarge. So they're not microscopic anymore. They're literally, the air sacs become very large with emphysema, to the point where you can see the air sacs in the lungs. And then you may have heard of bronchitis. You may have had bronchitis, but you had acute bronchitis caused by usually a bacterium or virus. Chronic bronchitis lasts for years, and that's permanent inflammation of the bronchi due to smoking. Um, or like I mentioned earlier, could be coal miners, could be farmers exposed to a lot of dust. So those two things, those two disorders, lead together to COPD. And I forgot to mention air pollution can also cause COPD. So kind of looking at lungs, this is a healthy lung, and you can even see in the healthy lung that there are little areas of black, little black dots, and this is just our environment, what we live in. There will be some air pollution, and that can build up over years, even though this is a healthy lung. But when someone smokes, you can see what happens. Just a total destruction of the lungs with this black, almost looks like death, the black tars and ash from smoking. Bronchitis, emphysema, so kind of reviewing that, air pollution, smoking, leads to dyspnea. Now, dyspnea is a new vocab word. Dyspnea is a word that means air hunger. So just a total hunger for air when you have COPD. You just feel like you can't get enough air, so oftentimes people will be put on ventilators that they can carry around with them. They'll have a cannula, which is the little tubes, the little plastic tubes that run into their nose to help them get more oxygen. People with COPD cough a lot. People with COPD get a lot of lung infections, very susceptible to pneumonia, and that can lead to respiratory failure, where the just total lack of gas exchange occurs, and that impacts the entire body. Already mentioned emphysema. A lot of people who get emphysema get a barrel chest. In other words, their chests get bigger as if they're working out. And they're working out, they're struggling to breathe, and that makes their chests larger. And that finishes COPD. Now, asthma is, along with allergies, by far the number one condition seen in students at Yorktown High School. And asthma is often caused by allergens in the environment, sometimes by exercise also. And really what happens when people are exposed to things that they're allergic to, the immune system responds to that and causes the bronchial tubes to constrict, get smaller, and more mucus is produced, and that leads to a characteristic wheezing sound when people breathe. And really the only way to solve the problem is to take an inhaler or to take some other drugs, some steroids. And then finally, lung cancer, one of the top cancers in the United States. Number one cause would be smoking. Number two cause would be air pollution. And first you can see this lung is very black due to smoking. You can see the emphysema, the large holes in the lungs, and then this white area is a tumor in the lungs. And really the way to solve the problem is sometimes you have to take the lung out. which is not the best thing. At least you have one other lung still functional, but that would lead to some issues with oxygen. You can do chemotherapy, you can do radiation to try to get rid of the lung cancer. Here's another one, kind of a side view of a lung. You can see the black tars from smoking, and then this tumor, and really another tumor right there in the lungs. All right, that finishes off our final unit of the year, the respiratory unit. So you will now do an assignment to get you ready for the last class period, the respiratory system test. I'll talk to y'all later. Bye-bye.